2?
And I give myself the half.
I'll give you a 5, 2.5. You ready to rock and roll?
At least the DMV.
Because they can already hear you. They can already hear you, ladies and gentlemen. And now they can see you. Look at this.
Hello.
See? It's a professional podcast studio. Look at you over there.
I know. I was
You
going to
look
like in
professional.
sweats or something like that. I'm glad I wore a blazer. It looks somewhat credible.
She's wearing a blazer, ladies and gentlemen. Well, good evening, everybody, and welcome to the Local Bizcast. And you very well know at this point, I am Dr. Pete. Joining me tonight is amazing Dr. Sakina Dinani. I am super excited. I hope you guys are all very excited. I feel like we're going to have a lot of fun. I think it
might be a little scary how much fun.
We're going to probably take a few left turns, a few right turns, and we're going to kind of go a little bit crazy. I hope you don't mind.
I don't mind.
Welcome to the Thunderdome.
Okay.
But first, a little business. I was told by the podcast gurus over here, so I'm getting more and more input, because I'm getting so popular with my 95 subscribers here. Thank you so much to all 95 of you. We're going to go break 100, and then we're going to go celebrate. But in order for me to break 100, you guys all have to like and subscribe. Got to go on here onto the Local Bizcast over here, YouTube and Spotify, and soon to be Apple Podcasts, working on all that. So if you guys are enjoying this, please help me get to 100 and then to 200 and then to 2,000 and then to 1,000,000.
And then he doesn't have to be a chiropractor anymore.
I still want to be a chiropractor, though.
But you don't have to.
I don't have to. I can do it for fun.
I was going to say, then you can do it because your heart tells you to.
Is it not telling? What are you thinking? By the way, this is my doctor, and she knows my heart better than anybody else, including Kelly.
So HIPAA's out the window as official.
I'm allowed to say whatever the hell I want. That's my life. HIPAA's out the window.
I'm still bound by HIPAA, so therefore I can neither confirm nor deny.
But somebody in this room knows my heart just as well as I do. Let me tell you. So when we talk about the business of Dr. Sakina Dinani, we can go into the business of it. I'll let you guys know everything, which is what I do anyway. But
kind of.
Welcome to the Local Bizcast.
Thank you. I'm glad to be here.
Yeah. Oh my goodness. And we thought we weren't going to have you because it's Ramadan over here, and we didn't really put that together like 3 months ago when we decided to book this thing. But
it didn't even strike me, the whole lunar calendar, and it completely blew my mind, which is why I didn't realize that it's
all good though. We did this at 5:30 p.m. though, so we're not worried about like
still 2 hours away.
We got some time before we do
still
that.
Have some time.
All right, but the people need to know. We want to know who is Dr. Sakina Dinani.
She's plenty of people,
and that's it. That's all the time we have for today.
So, Dr. Sakina Dinani is a physician who, over her 15-year career, decided that her goal.
I have no idea how old she is. There's no way you've been practicing for 15 years.
Yeah, I have.
Oh my God, look at you. What do you eat? I'm in.
It's not
us.
what I eat.
Oh,
it's what I don't eat.
There we go. Oh, brilliant.
All right. So
I'm not going to disturb you again.
So Dr. Sakina Dinani is the person who I am today because of the 15 years of medicine that I did go through, and I've loved every minute of it. I've hated every minute of it, and I've enjoyed every minute of it, and it's made me who I am today. And who that is a physician who understands that patients are people. Patients are looking for answers. Patients want a helping hand, a listening ear, and they want results. But they want results to the goals that they create. And being a physician who's trained in the allopathic and the osteopathic world, which means, your typical medicine track, as well as osteopathic medicine, which is a little bit extra understanding like body manipulation and things like that. But really taking
I don't even know who would understand that around here. What are you talking about?
But really taking my knowledge and my experience over the past 15 years and telling them, tell me what your goals are. Tell me what your issues are, or your health and wellness goals are, and let's create a plan. But let's not forget about all the textbook, clinical rigmarole, mammo, colonoscopy, everything to get a whole picture of their health. And that's who Dr. Dinani
Okay, good. Because I was hoping you would say that. Because what if somebody was like, I just want to continue to eat bacon cheeseburgers and drink 64 ounces of Coca-Colas every single day. What do you have for that?
So let's talk about that. So let's say they want to eat a Big Mac and drink
Cokes,
let's be a little bit more realistic. Soda. Like a Big Mac every day for dinner and soda, a 20-ounce soda every day for dinner. Okay. And that's like, this is my non-negotiable. They're like, okay. So what are you eating for breakfast, lunch, snacks? How are you exercising? And what's your kind of lifestyle plan? How old do you want to be? How long do you want to live? What are your family history factors? Did your father have a heart attack? Did your mother have a heart attack? Are there diabetics in your family? And is it a whole cheeseburger? Is it a hamburger without the cheese? Let's figure out what your to go is. Like, what's your bottom line? And let's figure out what is sustainable for you, because your answer is not going to be the same as mine.
I'm in love.
So
I'm in love. This is like, we've been trying to preach this for so long, what healthcare actually is.
But we do it. It's just, it's not seen that way. So for example, when someone comes to me or any physician and they're like, I've smoked for 20 years. Every single time that patient hits the office, someone's going to ask them, are you planning on quitting? Do you want to quit? But my responsibility in covering all the other bases don't go away. My job is still to make sure your health and wellness is a top priority and you're hitting all your goals. But just because you make one bad decision doesn't put everything else for naught, right? So you may smoke a pack a week, but you don't drink alcohol. So there's give and take, right? We're allowed to make bad decisions. My job is to kind of tell you where those decisions put you on this whole spectrum of health and wellness.
Yeah. I think the big key word, right? You were talking about non-negotiables, right? If you got it. You're going to live with the vices. You're going to have some non-negotiables. And as long as you can limit the non-negotiables to a certain, as you said, you can smoke, but not drink. Because if you're smoking, drinking, eating donuts and Big Macs.
Right. So what's your give? Like, don't ask me to give up Dunkin' Donuts, but I'll give up McDonald's. I'll give up smoking, and I'll give up, tequila on Tuesdays. Fine.
We have to give up tequila on Tuesdays? All right, fine.
I didn't say you drink tequila.
All right.
Yeah,
that's not my vice. It's okay. But yeah.
So essentially, everybody's to do and their plan and their life goals are totally different. So I'll give you an example. I can't break HIPAA, but myself.
Okay.
When I turned 38 years old, I was diagnosed as pre-diabetic. And it wasn't for lack of anything, but I have sucky Southeast Asian genes. My mom has had 3 angiograms. She's 64. My dad, he's got a whole slew of health issues with the typical Southeast Asian health issues genetically, heart disease, diabetes, thyroid, the whole 9 yards. So I was 38 and I wasn't much bigger than I am now, but I was diagnosed as pre-diabetic. And it was a wake-up call. I was like, no, I do not want to be a diabetic. I do not want to, have an angio at 44 or whatever it is. So I sat down and I made a list of my non-negotiables. And you know what one thing on that non-negotiable list was? I am Indian. I need roti. Like naan. So I gave up rice. I gave up potatoes, but I still eat bread. Like I do. But because it's a give and a take, right? I took away other things that I knew don't make me happy. They don't give me joy. And I kept the things that give me joy. And every 6 or so months, I do my own blood work and I realize I'm getting closer and closer to now giving up some of those things that give me joy. So then we'll get into the nitty gritty. Like I'll give up wheat bread or something else, but I won't give up roti, as we say. So like it's also understanding as time goes on, the things that bring you joy will also change.
You can evolve.
So you evolve with what your non-negotiables are. And that's really what healthcare is supposed to be. It's supposed to be having a partner in your health and wellness journey that as you are evolving, they're helping you evolve in the right direction.
I'm sitting here in awe. It's just so refreshing to hear this. And I mean, as I said, I'm not HIPAA violent. I'm a patient and I've heard this, but like hearing it in this setting, for some reason, it hits so differently. And it's just so amazing. Like, how is it that every doctor is not like this? What are we doing?
So it's not that every doctor is not like this, right?
Okay.
It's unfortunately our system is broken. And our system is catering to a volume versus quality. And it hasn't always been this way. And I don't mean to be putting my field down or anybody in my field down. It's just that when you work for someone and your payer is not the person that you're giving these services to. So I'm going to give you a frank example. When a physician works for a hospital and they give you a paycheck, and the person sitting in front of you is not paying the hospital. The patient is not paying the hospital. The payer is someone who's not even in the room with you. It's an insurance company. It all becomes a numbers game. How many patients can I get in that chair Or how many patients do I need to get into that chair that my employer needs me to get into? So I said hospital, but it could be any large corporations, right?
Now private equity joining the fun club.
But like, how many patients do I need to sit in that chair from 9 to 5 to meet the overhead of this company? Because the person paying isn't the patient. It's an insurance company. And that insurance company isn't even in the room, but they set a value to that interaction.
Right.
So,
and their job, just like you said, is how many people do I have to pay, have to see between 9 and 5 to cover the overhead? And the insurance company's job is how little can we squeeze so that we don't have to pay, so that we have more money to pay our shareholders, right?
So there's this evolvement because people are like, well, I pay my insurance company. Yes, you pay your insurance company. Your employer pays your insurance company. Then they say, we'll cover your costs that we deem medically necessary. And you have a deductible. So before I pay anything out, unless it's 100% considered preventative, we'll cover that at 100%. But anything, if you're sick, anything diagnostic, that's not preventative. So if you're having a stomach ache and you need to go for a test, that's not preventative, that's diagnostic. Your deductible's in play. Some people's deductibles are anywhere from $6,000 to $10,000.
I have seen a $20,000 deductible.
Yes.
Can you explain to me
an individual
what? Yes. Tell me what you have to pay. 20,000. Like, what are you kidding me? How are they getting away with it? I have no idea. Can we talk about this whole preventative? Because in my field, no preventative is covered at all.
So in general medicine, so I'm going to backtrack. I'm an internal medicine physician who worked in a hospital in acute care, infusion centers, ICUs, medical floors, ortho floors.
We're not going to just fast forward through the entire history. We're going to come back to this, guys. We're coming back to this, but let's go ahead and let her get our point in here.
But now I lost my
preventative.
So as an internal medicine physician, there's things that are preventative, right? So when you turn 40 as a female, a mammo is considered preventative. A pap smear is preventative. Your annual wellness visit is preventative. Colonoscopy if you're 45 years and older. Again, these are just general guidelines. Everybody's is a little bit different based on their history, but these things are considered preventative. So let's take a colonoscopy, for example. No, let's take a mammogram, for example. Woman turns 40, going for a mammogram, covered at 100%, whether the facility charges the insurance $100 or $1,000. It's covered as long as they're in network with that insurance. But let's say I'm 42, went for my mammo this year in August, or last year in August, and it's not 365 days, and I found a lump. And I go to my doctor and she's like, you need to go for another mammogram. Your last mammogram was clean, but we see a lump. It is now June. We're almost to that 1-year mark. That mammogram that you go for in June is not covered at 100%. It's considered diagnostic because it is a test done in response to a finding, and we need to diagnose a problem. So the insurance says your deductible's in play. This facility that you're going to is in network, and we've negotiated a rate of $600. And then they're like, we would pay that if you met your deductible. You haven't met your deductible. The $600 is on you. We will now deduct $600 from your deductible.
But then you have to pay the facility directly.
You pay the facility directly.
Right.
So if you choose a facility that is a standalone, that isn't part of a hospital, they do not charge what is called a facility fee. It is a fee that the insurance company and the hospital have negotiated, saying, well, we're a bigger facility. We hire more people. The cost of running us is more, so you should pay us more. So if you go to a standalone facility and the cost of that mammogram was $600, that's great. There's no facility fee. It's a negotiated rate. However, if you go to a hospital-affiliated radiology center, they'll say, well, we charge $2,600. And the insurance has negotiated that rate. So your healthcare choices in where you go also keep your costs lower. And the way that we kind of hide that $2,600 from the hospital is saying, well, it costs more to run the hospital, so they should get paid more. But that $2,600 is still coming out of your pocket. So they also say, but then it comes off your deductible. But if your deductible is like 10, 20 grand, and you don't have any major surgical plans that year or major medical issues that year, you may never even hit your deductible.
That's
would you rather pay $2,600 to XYZ hospital or $600 to standalone facilities
for the exact same procedure? For the exact same.
But there are times where it is important to say the hospital or the academic setting is more important than the facility. So in the same situation where it is a mammogram, right? I usually I help my patients with too, trying to figure out where to get their care. I usually tell them, listen, it's a initial mammogram. Yes, we found a spot. A radiologist will be able to find it. But when you go, make sure you get the CD of the images. Because what we do is I felt a lump. She felt a lump. There's a lump. If this imaging is read by a radiologist and it says, I think it's XYZ and it's not malignant, no further imaging necessary, you now have the CD. I'm not a breast surgeon, but I can refer you to a breast surgeon at, let's say, Columbia. You take that CD with you. You're allowed to get a second opinion with your insurance. And you take that CD with you and you give it to that Columbia oncologist, breast surgeon. They give it to their radiologist and they read that CD. You don't have to go for another CAT scan or mammogram or whatever it is. So then you're still getting a higher level of care. But if they say, oh, it's nothing, it's a nodule of fat, or, it's mobile, or it's gone now and we don't feel the lump, then you didn't get an exorbitant amount of care or go out of your way to get care unnecessarily.
But you advocated for yourself to make sure you got the second opinion and everything like that. And people don't know that they can advocate for themselves like that.
And that's what I also do, because I don't have to see 60 patients a day. I see on average 6 to 10 patients a day. My appointments last anywhere between, Mary, my nurse, will beg to differ. I say 30 to an hour. She says an hour to 2 hours.
Now, I think just because we were friends, it lasted forever. But I can't imagine, same as my new patients are out. I'm a chiropractor.
Right.
And my new patients are an hour at least because I get all this information. Can we go back to a little bit of the preventative? Do you mind?
I thought you were going to say my history. I was like, no.
We're going to get that. What are you talking about? We're not even a quarter. Oh, my God, we are. We'll get there, though. Don't worry. But back to the preventative. I want to know. You're saying people will be pushed away from spending even $600 to get that second mammography because it's $600. And right now, things are not easy, right? Do I really need to do that? Or do I wait? This, that, the other thing. You're telling me in not so many words that the insurance company is pretty much pushing people away from getting that second mammogram, even though it's within the 300, because it's in 300. So they'd rather this thing turn into breast cancer, then have to pay all the stuff associated with breast cancer, from the surgery through the whatever chemo and potential radiation and post-op, whatever it is like this. Why won't they just understand the value of a lot of preventative and educating people and finding providers like you and I who want to prevent things from happening? Isn't there a value to that?
This is going to sound horrible.
Okay, go ahead.
Insurance companies covering the bare minimum actually save enough lives to make it statistically significant.
Got it. Okay.
They can save more. I'm not saying they can't.
I'm not even talking about life saving. I'm just talking about cost savings here. Over the time, if you do more preventative stuff, all right, in our field, one of the things we talk about is nutrition. You do weight loss, you do nutrition. You're so amazing at that, right? So the idea is okay, and you talked about being pre-diabetic. If you then got diagnosed with diabetes and you had to be on metformin at 40 years old until, let's say, we
paid for that
forever. And then you're going to talk about high cholesterol and Lipitor and whatever it is, and your high blood pressure. So you'll spend the medications and all the things that happen with those types of comorbidities in the future. You'll pay, but you won't spend time or money educating people on nutrition and exercise and all that kind of stuff. So that's what I'm talking about with overall cost saving. It's got to be more expensive to be putting on people on medications for the rest of their lives, as opposed to educating them on preventative measures. All right, that's my 2 cents.
A common misconception is that we are beholden to the Food and Drug Administration, whether it's pharmaceutical companies or, med companies or labs or hospitals or doctors have no affiliation. We have one job. Okay, I'm not going to speak for everybody. I have one job as a physician. That patient sitting in front of me.
Yep.
I need to make decisions based on them. I don't get paid by a pharmaceutical company to put you on a medication. I don't. I don't get paid by the insurance company if I put you on a medication versus another medication.
Dude, you got to send out to a pharmacy. You're not making any money on that medication. It doesn't matter.
And I don't get paid whether I send you to CVS or Walgreens
Doesn't
or the
matter.
mom and pop pharmacy.
They get paid, not you.
They get paid. However, if you go to, so I believe, and I think I'm saying this correctly, Cigna now owns CVS. No, Aetna now owns CVS.
Aetna owns CVS.
Aetna patients who have insurance through Aetna pay lower copays and medication prices if they go to a CVS.
Isn't that unbelievable?
But
we can't charge people different basis.
No. But when you look at it from a perspective of business, okay, that makes sense.
Okay.
Money goes from the left pocket to the right pocket, right? But then the pharmacy also has to purchase medications from the pharmaceutical company. But who sets the price of that medication that gets paid to that pharmacy?
That would be the insurance company.
So that's where this is all connected. The insurance company, the pharmaceutical company, and the pharmacy. So the drug company, I'm going to say drug company, pharmacy, and the insurance company, they are all some sort of intertwined. The one that's not in that mix is the doctor.
This gal right here.
But the one that's always told, but you make money if X, Y, Z. I make nothing by putting you on a medication.
No.
No doctor does. No hospital does. No, they just don't. And we're talking about regular oral medications that you have to take for blood pressure. We're not talking about oncology. We're not going there.
Yeah.
So you have to realize when your doctor is asking you to go on a medication, they gain nothing from it. But they're also sometimes doing it because they are given 15 minutes with you because this same insurance company told him that if we need to make money or if you need to make money, you need to see 60 patients in a day. And there's only so much time in a day. No. So I sit there and I talk to my patients and I timed it. My new onset pre-diabetes. So this is before you even get to diabetes. Their visits with me, nutrition counseling, is usually anywhere between 27 and 47 minutes. I'm drawing diagrams. I'm explaining them because I've also learned that when I explain how things are working in your body, whether it's like the 100% truth or just to make sense, you hear my voice in your head when you go to pick up that bag of chips or that bagel. You're like, no, this is going to turn into XYZ. This sugar is going to end up on my cholesterol. Yep. And then I can't enjoy something else, or I'm going to end up being a diabetic. Like I'm so close. So when I explain things to my patients and I draw diagrams and I do this on purpose, it's so that it hits home how simple decisions going to the grocery store make a difference in you day to day. But I gain nothing by putting you on a medication. In fact, that trifecta, they gain everything.
Correct.
And
you gain more by not putting people on medications so that, I
have patients who are like, listen, I am not going to work out the 25 minutes a day you told me to. It's just not feasible with my lifestyle. Please put me on a medication. Everybody has their non-negotiables, right?
Negotiables. Yeah. See, comes full circle.
So they're like, listen, I would love to go walking every day. No problem. Not going to happen. I'm a single mom or I'm a single dad and I have to worry about getting the kids to school and I'm a hedge fund, whatever, I work 60 hours a week, 60 hours a day. And I'm like, okay, that's fine. That's fine.
Yep.
Well, we need to come to the common goal. So in my practice, we're partners. You're driving the car. I'm in the passenger seat.
You're the co-pilot.
I'm not. I'm actually the map. I'm literally holding the map. Remember those things we used to like
use? Backwest, TomToms, Garmin's.
Remember those things that we used to use maps?
Yeah. Oh, you're talking about you're not that old. I was going back to like the little navigation things.
I remember maps.
All right, let's go maps. There you go.
But like I'm telling you, there's 3 ways to get to your destination. And if we take one and the road's closed and we fail, that's not a failure. That was, we tried it this way, whether it was your way or my way, and we didn't hit the goal. Reassess and let's start again. Yeah. It's that key reassessment that is missing because people just don't have time.
They don't have time.
So when I went out of network with insurance, it was essentially to give me back time with my patients.
Yep.
And to be honest, I charge $249 a month for my services, whether you show up in that chair once a month, 10 times a month,
Yep.
16 times a month, I'm your doctor on retainer. You come to me for your annual follow-ups, medication refills, but if you're just not feeling well and you're like, something's wrong, something's off, it's my job to help you figure it out. We create the map. No, we don't create the map. We have a map and we create the path together.
I love it. That ties us right into what is Synergy Health Advisors. This is perfect.
So
remember, we're going to get to that point where we have like 4 minutes left. That's where we're at right now. I tell everybody, and we didn't even get to her history. I need to have a round 2, but we need to hear about Synergy Health Advisors. That's your company, and that's what you do, and you just described it wonderfully. But tell everybody else what it is.
Synergy Health Advisors is a direct primary care office. It's a primary care office where I take care of my patients. Yes, the nitty-gritty of annuals and follow-ups and all that stuff, but it's also setting your health and wellness goals and being your partner along that pathway. It is also looking beyond the typical textbook answers. So I think he will attest to this, but if you have a cold, I'm not just saying take this cold medicine. If that's your thing, that's great. But there's plenty of integrative things to do, plenty of things that we consider old wives' tales, but they work. And I'm not digging into why they work, but if they work and they help someone, that's great. So it's kind of thinking outside of the box to get answers for patients. And we also have an aesthetics portion, which Mary, my nurse, who's great.
Nurse Mary, shout out. Where is she tonight? Why are we getting her on here?
My office is still open. We have 8 hours on
Monday.
Still
open.
So she's holding the fort down.
Sorry, guys. We still get away.
So essentially, aesthetics, Botox fillers, things like that, because once you start to feel great on the inside, a lot of patients are saying, I want that to reflect on the outside. And there's nothing wrong with that. And so Mary handles that. And then we also have IV infusions, which is basically vitamin infusions tailored to each patient. We do have some cookie cutter ones for like hangovers and
little Myers cocktail action. You got to have one of those, of course.
Like essentially workout and performance and immune boosters. But a lot of my patients choose to get their blood work done or bring me their blood work, and then we create a custom cocktail.
Amazing. You also have weight loss. You do weight loss.
So that's part and parcel. So we do weight loss and we do hormone replacement therapy.
Hormone replacement therapy. Integrative care, you kind of talked about that, right? So, I mean.
So I don't consider myself an integrative physician. And I know people laugh when I say that, especially my patients. But it's more so pulling on the wealth of knowledge that I have that's both from a textbook, from experience, from my mom, my mother-in-law, my family, like things that have helped me and my kids and my family members. And I bring it to my patients. And together we decide what you keep, what you take, and what I take off the table.
First-hand knowledge right here, ladies and gentlemen. I can do attest to everything she is saying. She was there for me through my carnivore diet and my 5-day fast. She thought I was nuts.
What did I tell you about your carnivore diet?
You said if you could, it's got to be a lifestyle, right? It's got to be a life. Sustainable, right?
If you can be on a carnivore diet for the rest of your life and
right.
you are happy-go-lucky and you don't mind and you hit your goals on that, if it's sustainable, that's right. Great. But if you're going to fall off the wagon, that's not the answer.
There you go. And how about the 5-day fast? You can't make that a 500-day fast.
No, you can't.
But I was 180.4 pounds on that Friday morning. Did I send you the picture? I was
Although
light.
Patients do text me their pictures.
I'm sure they do. It was my ugly feet, but it was on the scale. It was 180.4. I haven't been 180.4 pounds since I was in high school. So, but I wasn't. Again, weight loss was not my goal. I actually looked decent. Exactly right. So getting into ketosis, starting to do all that kind of stuff. I have a minute left. I need 100 hours with you. I need to know where you came from.
Because we talk too much. Both of us.
This is what we do. It's perfect for the. Do you want to be my co-host? Do you have time for a little bit more?
You wanted me to ask me that off camera?
No. She said no, ladies and gentlemen. I'm just going to let you know. Her eyes went like this way a little bit back and forth, but.
I don't think our guests would get a word in.
We would have a 6-hour podcast. Somebody would be sitting right here, like where Dr. Chris sits all the time. They wouldn't say a word. We would just have you there. You were just our guest for that day. You're just going to watch us talk. I feel like it would be impressive. We could probably talk the entire time.
I think we have.
Well, this is your podcast. Truth. Oh, I think we've only been live for like 28, so I'll have about a minute to finish up because, ladies and gentlemen, she's amazing. She's right here in Montvale, right across the street from my office where we're filming this right now. Sakina Dinani, Dr. Sakina Dinani from Synergy Health Advisors. You have to go and check her out. Her healthcare is health care. She spends the time that people need and deserve, especially these days. Guys, if what we were doing was working for the last 50 years, we would all be healthier. We are not. We're getting more unhealthy. She is going to unlock the keys. She has the map, and she's going to help us get to where we need to get to. Did I hit that right?
I think you hit it right.
All right. I have to announce my next guest because we're already there. Coming on Wednesday morning, this Wednesday morning, that's going to be at 8:30 a.m. on the Local Bizcast live on YouTube and Spotify. We've got Dr. Carol Chu Peralta. Do you know who Carol Chu Peralta
I
is?
refer patients to her.
Ladies and gentlemen, Center for Resiliency. She is a super busy woman. We've been texting or emailing back and forth. I'm super happy and really lucky to have her for 30 minutes this Wednesday morning. I hope you guys could all join us on the Local Bizcast. Remember to like and subscribe and enjoy. I can get Dr. Sakina Dinani and Dr. Carol Chu Peralta here. I'm going to get everybody on here. I'm going to get you on here as well, because if you want to come on to the Local Bizcast, please reach out to me either on Instagram at the Dr. Pete, or just email me, drpete@shcnj.com. That is the best way to get onto the Local Bizcast. I am looking to help all the local businesses, the local entrepreneurs, the local influencers, and people just like you, Dr. Sakina Dinani.
Thanks.
You did absolutely amazing. Will you come back?
Is
Maybe
there
in a year.
left to say?
We didn't even. I'm going to quote Gleaming the Cube, one of my favorite movies from back in the 80s. This is not the end. This is not even the beginning of the end. This is the end of the beginning.
Oh,
You like that line?
I like that.
Gleaming the Cube, guys. That was for you. So, ladies and gentlemen, I hope you have a wonderful evening. Between the next time I see you, probably, or now and the next time I see you, it's going to be Eid. So you'll be able to have, we don't know when that's going to be. Is that correct?
Lunar calendar.
Lunar calendar.
Depending
So
on the sighting of the new moon.
Sunday, Monday, we're looking. But this Sunday, Monday. This Sunday
or Monday.
So it's coming soon. Coming soon. I wish you luck and everything.
Thank you.
She's amazing, ladies and gentlemen. Thank you again to Dr. Sakina Dinani. We'll see you guys next Wednesday. Well, actually, this Wednesday. Bye-bye.